Hi, everyone. It's the first Tuesday of the month and the first Tuesday of every month. We always come at you here live with a new webinar and a new topic. And today's webinar is going to be, there we go. Today's webinar is going to be, I don't know what that is. There you go. Today's webinar is going to be on pregnancy. Sorry about that. We're having little issues. There we go. Now we're live. Okay. So today's webinar is going to be on pregnancy and talking about chiropractic care, whether or not it's safe if you're pregnant, how does chiropractic care work when you're pregnant, and can I go with a chiropractor if I am pregnant, and is there anything I need to know about going to the chiropractor on these topics. Tonight, my plan is to go through and do some literature review, talk about some different things, focus on some of the areas that chiropractors work on, show you some of the research, show you some of the science, review some of that science with you, go over some of that science with you, and hopefully this is all working. Hopefully everybody can hear me, and hopefully everyone's communicating well enough. So let's get started here. So can you go with a chiropractor if you're pregnant? The answer is absolutely yes. Chiropractic is a great choice to come here if you're pregnant, because as chiropractors, we are able to take care of you safely. A lot of times when you're pregnant, you don't want to do a lot of medications, you don't want to do a lot of drugs and other bad things like that. So chiropractors can definitely step in and help. What are some of the benefits of going to the chiropractor when you're pregnant? Well, one, we can definitely help with the lower back issues, right? Because that's kind of what we do normally when you're not pregnant. So we can definitely help out with that. There's also a thing called pregnancy carpal tunnel. What happens when you're pregnant, your rib cage comes out and out like this, and it will jam up around the base of your neck and cause what they call pregnancy carpal tunnel, where your hands go numb. As chiropractors, we can look at the base of your neck and help you out with that. So a lot of women complain about that. We're definitely able to help in those areas. And of course, the other thing that chiropractic research shows us is that we can also help with the delivery, not actually go to the hospital and deliver your child, but we can actually help make delivery easier, and easier on mom and easier on the new baby we haven't met yet. So chiropractic is definitely safe. Now, let's take a quick look here, and let's look at some of these videos here, a little bit of research here on this. Let's take a look. Here we go.
Pregnancy can be a really exciting time for parents as they get ready for their family to grow with baby's arrival. This often means setting up a nursery, shopping for baby clothes, car seats, pushchairs, and lots of nappies.
Looks like we got a little pause here, sorry.
It also means mum's body is changing as baby grows and mum prepares to give birth. Sometimes these changes can be uncomfortable or even painful. In fact, about 3/4 of pregnant mums suffer from pain in their back or pelvis while they are pregnant. This is one reason so many pregnant mums seek chiropractic care to help them through their pregnancy. When deciding whether they should see a chiropractor, pregnant mums often ask, is it safe to get adjusted by a chiropractor when I'm pregnant? The good news is that chiropractors can tailor the care they provide to each individual patient, and the research suggests that chiropractic care during pregnancy is safe for both mum and baby. But what does the research tell us about the benefits of seeing a chiropractor while you're pregnant? When it comes to back pain, not many big studies have been done yet that have looked at whether chiropractic care helps. So although more research is needed, results from the research that has been done so far are promising and seem to show that for some pregnant mums, chiropractic care can be really helpful. In one study, researchers in Switzerland followed 115 pregnant mums for a year who went to see a chiropractor with low back pain. What they found in this study was that over half of the patients said that they improved after just 1 week of chiropractic care, and after a month, that figure had grown to 70%. By the end of the study, about 90% of pregnant mums said their pain was better. From this study, we can't be sure if it was the chiropractic care that really helped them, but at the end of the study, over 85% of the mums said they were happy with the care they received from their chiropractor. One other area that researchers think chiropractic care may help pregnant mums is with the delivery of their baby. For women in labor, the ability to relax and contract her pelvic floor muscles is really important for helping baby to move through the birth canal. Ideally, for the birth process to go as well as possible, giving the greatest chance for a natural vaginal birth, you want strong pelvic floor muscles that can relax and contract at just the right times. In a study conducted in New Zealand, researchers studied pelvic floor muscle function in pregnant women before and after they were adjusted by a chiropractor. What they found was that after the pregnant women were adjusted, their pelvic floor muscles appeared to relax more. This relaxation of their pelvic floor muscles after they were adjusted may mean that chiropractic care could help them to have a natural vaginal delivery. This was only a small trial, and the researchers couldn't be sure how much of an impact these relaxed muscles would have on labor itself. But it does suggest that for pregnant mums, chiropractic care may give them some control over their pelvic floor muscles, which may make childbirth easier. Other research supports this idea, with one study reporting that new mums experience on average a 25% reduction in the length of labor time with chiropractic care during pregnancy, and that rises to a 31% reduction for mothers who have given birth before. It makes sense to keep yourself as healthy as possible during your pregnancy. So if you want help with the way your spine and nervous system are functioning, consider seeing your family chiropractor, because it's natural, safe, and may help you to feel better and boost your chances of having a faster, easier delivery of your little bundle of joy.
All right, so that's Dr. Havoc. She does a research center out of New Zealand, and she always has great chiropractic information for us. But I'd like to actually take a minute now and go through some of the stuff that she discussed. So the lower back pain, that stuff's pretty, cut and dry. A lot of times we have an upper lower back rotated, pulling on the pelvis, causing this imbalance. Now this becomes particular interest because one of the muscles that often goes up against the back of the womb is a muscle called the iliopsoas muscle. Now, the iliopsoas muscle starts in your upper lower back, your L1, L2, travels through your pelvis and goes to the front of your leg. So a lot of moms will complain about growing pain during this time, or maybe walking upstairs or getting up from sitting down. But when this area is misaligned, it creates a condition called tortopelvis, where the whole pelvis will rotate and spin and create a lot of problems with mom's lower back pain. So as chiropractors, we usually look at the upper lower back, and then we also take a look at the hips. Now, if you've never been to a chiropractor before and you're pregnant, we will not take x-rays of you because you're pregnant unless there's a life-threatening situation. But even then, we'd probably work with your OBGYN or something like that. But for the most part, we don't take x-rays of you. So we use instead we use a table drop. See, our chiropractic tables are designed specifically to give you the best adjustment we can to be as comfortable as possible, both when you're pregnant and when you're not pregnant. So when you're pregnant, what we do is we change the table. There's an abdominal piece right where the baby would be. We lock that out of the way to make it safe. So when you come in here, we lock that out of the way, and then we use the table drop, but the table makes a thumping noise. That's what we use to take care of your tailbone and lower back. Without x-rays, we can't go overly aggressive. If you're an existing patient, or if you have x-rays somewhere else, we can use those x-rays and get a little bit more aggressive with you. So it's always safer with the x-rays versus without the x-rays, but we could make no x-rays definitely work. That is not a reason to stop. So what we do is for that lower back, we take a look at that upper lower back and those hips, and you'll hear those hips drop a couple of times, and the table will pop, 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 and that's how we get that back into place. So that popping noise is the table. That's not you. The next thing we look at a lot of times when someone's pregnant, they talked a lot about the idea of that the floor of the pelvis needs to open up and relax in order to let the baby get out. Well, as chiropractors, we know there's a thing called the sympathetic nervous system and parasympathetic nervous system. Your sympathetic nervous system is that fight or flight you've heard about. The baby's trapped underneath the car, the mom gets a super strength, or you're being chased by a tiger and your sympathetic nerves take over. Well, if you have a nervous system that tells you there's danger and you have to react, you have another nervous system that tells you the danger's gone, it's time to relax. And for everything belly button down, generically speaking, that comes from your sacrum or your tailbone, what you sit on. So whenever we have a woman that comes in who's pregnant, we always spend a lot of time analyzing her sacrum, because in order for the baby to grow and the womb to stay relaxed, that sacrum has to be at the right place. So we always take a look at your feet, we'll bend your knees and stuff like that, and that's how we figure out what's going on in your sacrum. Again, without x-rays on most pregnant women, and also, even if you are pregnant and we have x-rays of you, when you are pregnant, you change. So the way we test you is we bend your knees and look at the way your feet move and don't move, and bend your knees all the way up as far as we can, see which side doesn't move and does move. And that allows us to know what your sacrum's doing by how it pulls and tugs on different areas. So that's how we analyze you. Now, speaking of the sacrum, there's another really important adjustment that we do for pregnant women that was not in the video, but it's a really well accepted adjustment. We get midwives and OBGYNs that refer to us all the time for this adjustment. It is called the Webster technique. Now, the Webster technique was originally invented for a breech baby. And a breech baby is, if you don't know, a baby that's sitting in the wrong position. And the baby is going to come out feet first and head first. The baby's not in the right place. So Dr. Larry Webster, chiropractor, discovered a chiropractic technique, a chiropractic adjustment to adjust that sacrum on mom in order to get those muscles to relax. So then everything can relax around the womb. The womb can go in its normal place, and then baby will flip itself naturally. A lot of times when chiropractors talk about giving an adjustment to move a breech baby, because we're a lot of hands-on, a lot of people instantly start thinking that we're going to grab a hold of the womb and try to move the baby around. And that's not at all what we do. We want to influence the womb by affecting the nerves around the womb and affecting the muscles around the womb. So for the Webster, and it's Webster like Webster's dictionary, you can look it up. The Webster technique, what we'll start off with is we do that same sacrum analysis I talked about. We'll look at your legs, see how they move. And then we'll do the table, will make that popping noise, 1, 2, 3, and we'll see what the sacrum's doing. From there, we'll do a series of different trigger points and stretches to get the muscles and stuff around the womb to relax. So the moment you tell us you're pregnant, we instantly start doing the Webster technique. That's very, very important to us. We used to wait to use the Webster until about 25th week, or 35th week when the baby was breached. But now all the new research shows that the best thing to do is start it right away. Why get a breech baby and fix it? Let's just not have a breech baby in the first place, right? So that's kind of the new approach, the new attitude. Let's not even start having the breech baby. So we'll start that as soon as you tell us you're pregnant. We'll start that. Actually, we have a lot of people that come to us who are trying to get pregnant, and we'll start that right away during that time period too, because we never know for sure exactly when we get pregnant. So we start that right away. So again, when we look at moms, adjusted moms for who are pregnant and how to help out with pregnancy, a lot of it has to do with that sacrum and the nerves that help us relax, the parasympathetics, getting that sacrum lined up. I'm going to briefly talk about up here again. That wasn't in the video. I talked about it a little bit before. When you're pregnant, your rib cage will change shape. It'll expand up and come up, and it'll pinch on those nerves coming on your arms. So we get the base of your neck, your cervical neck right here, C5, 6, and 7, and your upper thoracic, T1 and 2, those first ribs are. And we'll do an adjustment there too to help your hands feel good and strong. We want to make sure you don't get any numbness and stuff in your hands, because I imagine when this baby comes, you're going to want to hold and cuddle this baby a lot. So that's kind of how we handle that, just so you're aware of that. So that's kind of how we handle these, how we take care of pregnancy. Again, what we'll do is you'll come in, you'll tell us you're pregnant. We're going to change our table. We're going to move the pieces out of the way. We're going to bring these other pieces up. We're going to change how it looks in order to fit the pregnant mom. And that works all the way through the end. We have pillows and other things that we use also. We always look at mom's sacrum. Take a look at mom's sacrum is so important. It's so important with the nerves that innervate the muscles of the pelvic floor. We look at the L1, L2 above it. If mom's having lower back pain, then make sure we're not getting tugged and yanked on that. And some of the little tips I tell the moms too is that there's a ligament in the front called the round ligament. And what you want to do is you want to knead that ligament. How do you do that? Well, you go from the belly button to the hip and you go in the middle and you kind of meet right there. Then you take the palm of your hand right here and you kind of knead downwards. You can't really see me because I'm sitting down, but you knead your hands downwards into the groin to make sure that round ligament stays nice and loose. The round ligament of the uterus is the only ligament in the human anatomy to have a muscle in it. So if that muscle should spasm, it's going to push up against the womb. It's going to give mom a lot of anterior front side pain the whole pregnancy. So the moment you find out you're pregnant, I tell everyone to make sure they knead that the whole time down. The other thing we want to do is we want to minimize the stress of the lower back. So the moment you find out you're pregnant, one of our rules is always keep your knees below your hips when you're sitting down. Don't ever lean back with your knees up real high. Keep your knees below your hips whenever you're sitting. It keeps the lower back in the place it needs to be off that womb and keep that lower back pain to a minimum. A lot of times we find out is that when somebody they have been doing these things, it's hard to catch back up on. So that's kind of some of the things we talk about. Now, another thing we do here in chiropractic care is that if you, for fertility too, chiropractic care has been helping known a lot with female fertility issues. Those of you who have never seen it, I want you to go to my website, rockforddc.com. When you go on there, there's a video of our family story. I want you to take a look at that video. It talks about the story of Bob and Ruth Holzabus, my grandparents, about how they weren't able to have children until they met a guy named Dr. B.J. Palmer. Dr. Palmer was able to help take care of my grandmother. Next thing you knew, she was pregnant with my Uncle Roger. And the next thing you know, you've got 3 generations of Holzabus chiropractors. So take a look at that video, Rock for DC. You see that it's coming across the bottom right here, rockfordc.com. Go take a look at that. So that's kind of the nutshell about pregnancy and a little bit of a hint there about fertility. But I do want to talk about one more thing here. I want to talk about what after the baby comes. Before I do that, though, I do want to say this. If you have a comment or something like that and you're watching with me live, either on YouTube or Facebook, you can leave your questions below and they will pop up on my screen and I will see those questions and I will do my best to answer you. So if you're watching live with me right now, was it the Tuesday night, the 6th? If you're watching us live, go ahead and leave a comment down there. We'll see it. Now, if you're not watching live and you're watching this later, you go ahead and leave a comment. We'll get back to you. We always do. But before we do that, let me get into one more topic here, one more piece of research, a little bonus research tonight. Usually I only do one of the research topics, but we're going to do a bonus one tonight about after the baby comes.
For many mums and babies, breastfeeding can be a real challenge. We know that about 80 to 90% of mums try to breastfeed at birth, but by 1 week of age, as few as half of mums are still exclusively breastfeeding. This figure continues to drop, with only about 1% of mums exclusively breastfeeding when baby is 6 months old, which is the recommended time we should exclusively breastfeed for. There are, of course, lots of reasons why mums give up on breastfeeding, from sore nipples to inadequate milk supply or baby having issues with latching or suckling. All too often these problems lead to too much pain or even breast infection and ultimately, and understandably, mum giving up on breastfeeding because it just gets too hard. This is a real shame because we know that breastfeeding is really important for babies' health. We know that babies who are breastfed are less likely to suffer from ear infections and tummy bugs. They're even less likely to develop asthma and other conditions that can be life-threatening. It just goes without saying that nature knows best and that breastfeeding is the optimal form of nutrition for infants. So if someone is having issues with breastfeeding, what can they do about it? Luckily, help is available. Lactation consultants and other health professionals can really help mums and babies to overcome the breastfeeding issues. And one healthcare profession that many new mums turn to for help is their family chiropractor. But why might a chiropractor help with breastfeeding? Well, the answer is really simple. Chiropractors see babies to help improve the way their body and nervous system functions so that they can get the best possible start in life. But why might a baby have problems with the way they move or function? That's another simple question to answer. Spending 9 months growing in mum's tummy can be really cramped. Before baby is even born, the pressure they're under in mum's uterus can cause changes to the way their bones move and fuse together, or the shape of their skull. And then the strains baby faces during delivery, either as they pass through the birth canal or from forceps or other forms of assisted delivery, can cause injuries to baby's spines or nervous systems and other joints that doctors and parents may not be even aware of. We know that successful breastfeeding relies on lots of complex movements that involve the spine and jaw. And we know that babies with breastfeeding problems often have imbalances in the way their spine and jaw is working. We also know that chiropractic care has a positive impact on the way our spine and jaw works. So it's possible that chiropractic care may help with breastfeeding problems. So what does the research tell us about whether chiropractic care can help mums and bubs who are struggling with breastfeeding? At this stage, large, costly clinical trials haven't been done to really study how much chiropractic care can help, so we can't say for sure how effective it is. But what the research that has been done does tell us is that many mums who take their babies to chiropractors because they're struggling with breastfeeding report really good changes after their baby is adjusted. In one study that was conducted in the UK, the researchers followed 114 mums and babies who presented to a chiropractic teaching clinic for care. All the babies were under the age of 12 weeks, and they were all unable to breastfeed exclusively. The babies were seen by the chiropractic students up to 9 times, and the student used low-force chiropractic techniques to release tension and improve muscular imbalances. The researchers were most interested in whether mum and baby would be able to breastfeed exclusively after they received chiropractic care. But they also looked at mum's rating of overall improvement and baby's weight gain. What they found was that all of the children showed some improvement, with over 3/4 of them being able to exclusively breastfeed after just 2 to 5 chiropractic visits over a 2-week period. From a study like this, we don't know how much the placebo effect was involved. And with care provided by chiropractic students, we don't know if the results would have been even better if an experienced chiropractor provided the care. But what we do know from a study like this is that it suggests that for some babies with breastfeeding problems, chiropractic care really may help mum and baby to breastfeed exclusively, which is a great thing for mum and baby alike. We also know from other research that when appropriately applied, chiropractic is known to be safe for kids and babies. So if you're having trouble with breastfeeding, it's a good idea to have your baby checked by a chiropractor to make sure they get the best possible start in life.
All right, so let's talk about that video. A little bonus there, breastfeeding and babies. So first of all, I talked about when chiropractic care is properly done to babies and stuff like that. So I want to hit that topic real quick. When chiropractic care is done to babies, what chiropractors do when we go through chiropractic school, we take a class on taking care of babies. It's a whole semester just on taking care of babies. Because the thing with babies is babies can't walk, babies can't communicate with us, babies can't point to where there's bothering them. New babies can't crawl. So all the things that we use to take care of an adult don't apply to babies. Now, whenever you see a chiropractor, you'll see us sit in the back of the room watching how people stand up and move and sit. Do they have a high shoulder? Do they have head tilt? Do they have a low hip? Do they drag their foot when they walk? Those are all clues to us to say what's going on with their spine and their posture. So with babies, they don't have that. So we actually go through special training to look at the baby to see what's going on with them. I mean, there's simple little things like, so muscles and ligaments all attach to the bones, right? So if a bone's crooked, the muscle and the ligament's going to move. So we're able to like squeeze the baby and do little things with the baby, move the baby in different directions to see what's moving and not moving in order to analyze the baby. Now, there's never any pain with this with the baby. The baby's never any shock or trauma, nothing like that. There's simple little things. I mean, one of the ways we look to see how the neck rotates is if you hold a baby upside down for 1 second, a baby would laugh, a baby would think that's fun, but a baby with a neck out will turn the baby's neck in a certain direction to show us what's going on. So when you come in, we walk through all that with you real closely. So if you're having a little one that's having a hard time breastfeeding, if you have a little one that's having a hard time sleeping, if you have a little one that's having a hard time with bowels, if you have a little one that has colic, these are things that we look for in the newborns, and we have our own little test. Now, they also talked about a low force technique. I made notes down here. They talked about a low force technique. Well, as many of you know, I'm the chiropractor for the Rockford Ice Hogs, the AHL affiliate of the Chicago Blackhawks. Some of those boys are pretty big, and to adjust those guys, we have to give it a little bit of ump. We also help out with my brothers trucking, and some of those guys are kind of big in different ways too, and we have to give them a little ump too. Well, with babies, what we do is we find the spot that's subluxated, misaligned, as we call it chiropractic, and we just kind of like put our finger there, and we establish a presence, and we just put a steady pressure on there, and it just kind of goes. If it's stubborn, sometimes we'll sit there and we'll vibrate a little bit like that. But we'll walk you all the way through it. I know with a new baby, a lot of nerves are there. Every mom and dad want to do the best thing in the world for their baby. They don't want to put their baby at any risk. We walk you through it step by step by step. So there's absolutely no fear. We tell you exactly what to expect. My favorite part about adjusting the baby is the baby's eyes, because a lot of times you're just an adult and you don't always know how it goes. But with the baby, instantly they'll light up. I just had a little one here the other day, and the moment I adjusted this little hip, he just started giggling and carrying on. I'm like, oh, we got rid of that problem. He's a happy guy now. So yeah, when it comes to adjusting babies and stuff like that, we get it all the time, especially for their breastfeeding. I tell mom if they're not eating, they're not pooping, they're not sleeping, and they're colicky, you can bring them in here. We'll help you out. Let's talk too about mom and letting milk let out. Sometimes not the baby, sometimes mom has problems. I talked briefly about the stress nervous system, the sympathetics, and the relaxing nervous, the parasympathetics. If those are misaligned in mom, sometimes mom has a hard time too. So we'll adjust mom to help mom out with those areas. We've had great success with that. I know the video didn't talk about just in mom, but we've had great success just in mom too to help with the milk letdown. So those are some of the areas and some of the ways we help as chiropractors, helping out with pregnancy. I hope some of you maybe know someone's pregnant, having some tough time. I hope this video can help answer a bunch of questions. Some of you also, I talked a little bit about the babies. We'll probably have future videos. We'll talk more about babies and other things like that. But I wanted to just kind of briefly talk about it because we all know what comes after the pregnancy, right? The baby. One of the things too, I tell all the new moms is a condition called CBS. I call it cute baby syndrome. You get CBS because you have this new baby and you're just hugging like this. You look at them all the time. Then all of a sudden mom comes in or grandma comes in. They have this horrible neck and shoulder pain. So I tell you, every time you put the little one down, stand up, squeeze those shoulder blades together, pull them down and count to 10. That helps a lot with this because this is really important, right, for mom and baby. So make sure you do lots of that. And then when the kid gets a little older, we're talking about mom hip because you always see mom with the kid on her hip trying to get everything done with this hand over here. And they come in, their whole lower back's twisted. So we get all the moms and dads tips and grandmas and stuff like that, tips on those areas. So if you know someone that's pregnant, please share this video with them. If they have questions, our door is always open. We've been here since 1949, helping take care of our family, take care of your family. We're not going anywhere. We're not changing anything to how we do things. We get better with technology, but we keep doing the things that my grandpa did, my dad did, and everybody else did. So we're always here to help out. And we're here to answer questions. You know, if you have a question about chiropractic, how it works, I just ask you to ask a chiropractor. Don't ask your dentist. Don't ask your podiatrist. Don't ask your optometrist. Don't ask your family doctor. They're not them with the chiropractic school. We have other websites. icpaforkids.org is a great website. I think it's .com. icpaforkids.com. All kinds of cool stuff about pregnancy. The chiropractic.org, my favorite website. All kinds of good stuff on there about literature and review. See, in order to I did this a couple different times. In order to get advanced in the pediatric world of chiropractic, you have to write and publish papers and be part of research things. So even though you might hear kids and pregnancy and all this stuff is kind of like, you might see on the internet, like it's like controversial and not well known, there's nothing more studied in chiropractic than this. So there's tons of information out there. Chiropractic.org is an amazing website to get lots of cool information. Or you know what, if you want more information before coming in, you just send us a message here and we'll get back to you. We'll give you all the information you need. And of course, our door is always open, always there for you. Other than that, everybody, it's good to see everyone again tonight. I'm looking forward to not doing these and actually meeting you in person and sitting down and talking again. But stay safe, stay strong, and thank you for your time. And we'll talk to you again real soon.